Welcome everyone to today's webinar. I hope everyone's doing well today. I'm going to try to chat and talk at the same time. Can everyone see the slides? Can everyone hear? Well, if you can't hear me, you won't be able to answer me. That's why I put in chat. Okay, so welcome to today's webinar. I just have a few slides before we turn it over to today's presentation. I just wanted to let you know about ASHA's vision. We envision healthy students who learn and achieve in a safe and healthy environment, nurtured by caring adults functioning within coordinated school and community support systems. Just a few things about ASHA. We have a few member benefits in case we have some people who are on the call that aren't ASHA members. If you become an ASHA member, you get an online subscription to our Journal of School Health, free continuing education credit, so you could get free CEs for our journal self-studies, webinars such as today's webinar, as well as on-demand webinars, and then free CEs for our annual conference. We also have forums for connecting with school health professionals online and discounts to American Academy of Pediatrics publications. Just a not a reminder, but a heads up for other upcoming webinars. So we have one on September 22nd, another WSCC webinar. So the two, today's webinar and the September 22nd webinar really go hand in hand and are a good combo, as well as October 13th, we have one coming up, and then a big grant writing workshop that has kind of self-study components through our Learning Center, as well as live webinars for participating and asking questions about the grant writing process. So with that, I'm going to stop sharing and turn it over to today's presenters.
Okay, I think I'm unmuted and I have slides up, but can somebody yell out if we don't? Okay, Marlene is saying yes, so I think we're good to go. Welcome everyone. It doesn't seem like it's September 1st, but it is, and it's halfway through September 1st. So in case you weren't in the wrong webinar today, we are covering supporting whole child success through school policy evaluation aligned with the WSCC model. I need to advance my slide. There we go. I'm Sandy Chafouleas. I'm a professor in school psychology. So my background is in school psychology. I train our master's and doc students at the University of Connecticut. I am also the co-director of the Collaboratory on School and Child Health. So you'll hear a little bit more about me and my stories as we go along, but basically I'm all about the social, the emotional, the behavioral space, and really coming at it from a practice lens. So when I was working in just different districts in my earlier years, my expertise was all about really intensive supports in social, emotional, and behavioral realms. And you'll hear from me in a little bit. I'll let Marlene introduce herself and then we'll keep going. But about why I love working with Marlene and why I think this is such a great partnership between us to be able to really advance our thinking about what we're doing with the how in this WSCC model. And I think you might as well introduce yourself. So go ahead.
Sure. Yes. Hi, everybody. I'm Marlene Schwartz. I'm the director of the Rudd Center for Food Policy and Health at the University of Connecticut and also a professor in Human Development and Family Sciences. My background is clinical psychology. And in the beginning of my career, I was doing clinical work, particularly for eating disorders and childhood obesity and adult obesity. And this was in the sort of 90s, early 2000s. And as particularly the childhood obesity issue became so much more pronounced in the United States, I started looking at, what can I do beyond just working with individuals in my office to really try to change the environment so that it's easier for parents to raise healthy children. And just really felt at that point that there were so many things in schools and food marketing and, just the overall food environment that was undoing everything I was trying to do when I was working clinically with families. And so I shifted my my research at that time to really focus on school food. That was the first place I started. I've also done work in childcare and the charitable food system. But when school wellness policies, as you'll hear, became a federal requirement, it was a real opportunity to think about how can we use that mechanism to really improve the nutrition and physical activity environment, specifically in schools. And then when I came to UConn, I met Sandy and learned more about the WSC model. It just felt like a natural partnership to try to put our expertise together to address multiple components of that model.
So we're going to tag team throughout the day, throughout the hour, across the different objectives that we have here. I will say that you are muted through the presentation, but if there's something that you really want to ask during the presentation, please put it in the chat because we'll each be monitoring the chat as we go along. Although we do have the opportunity to have you unmute and use chat or voice around the last 5 to 10 minutes of the presentation to ask questions. So without further ado, these are the objectives that we've specified for today. Dive a little bit more into what that WSC model is. Really look at those federal requirements in policy around local wellness policy and components, and see how that's come together in the work that we've done to create this tool called the WellSAT WSCC. Look at how it works. Get our toe dip in terms of what it looks like in terms of evaluating sample policy. And then talk to you a little bit about the different tools and resources that we have to help strengthen your evaluation process around school policies. I'm assuming that most people are here because they know a little bit about this model and this picture, this wheel. We call it the wheel. And they know, a little bit of the origins of how we put all the blue parts together. And what we're really trying to do is advance whole child development, have kids be as successful as they can by putting all these pieces together. As you just heard in my introduction, the work that I do is kind of down, or the specific work that I do, or my specialty or expertise, is down at the bottom of this wheel in this social emotional climate, the school counseling, the social services. Marlene might be over on the upper right hand side. But the reality is that neither of us is going to accomplish the goals that we have expertise in unless we figure out how to coordinate and work in pulling all of those pieces together. And so what I loved about this re-envisioning of coordinated school health model into this WSC model is the idea of the white part. And it doesn't get as much attention, right? It's the white part right in the middle. It's that coordination of policies, the laws and mandates and standards, the processes, the ways of doing, and then the practices, what we're actually doing. That's the nuts and bolts to me of how this whole wheel is going to work. And I was thinking about it this morning, actually, and I thought, what it is, it's kind of like, it's like your brain. Think about your white matter, right? The white matter in your brain is the stuff that is the way that we exchange and communicate information across the parts of your brain. And to me, that's the same thing that we're seeing in the white part of this WSC model. It's the coordination of policy, process, and practice. So today we're going to be focusing specifically on the policy and coordination across the blue parts and thinking about coordination and integration across the blue parts. But we'll come back at the very, very end and just remind everybody or remind ourselves that it's really the coordination not only across the blues, but across the policies, the processes, and the practices involved in the entire space of the WSC model. And I think that's where we're going to turn it to Marlene.
Sure. So as some of you may know, school wellness policies really became a term that was familiar to people in the field back in 2004. It was the WIC Reauthorization Act, the federal act that sort of snuck in, even though this isn't WIC, this was schools, but it snuck in this requirement to have all school districts create a written policy. And the components that were required were goals for nutrition and physical activity, nutrition guidelines for all foods available during the school day, a statement that all the reimbursable meals follow the federal regulations, and then a plan for measuring implementation of the policy. And finally, it was written into the original legislation that you needed to involve multiple stakeholders. So that idea of trying to get everybody in the room together who were responsible for different aspects of what we now, sort of are looking at with the WSC model was kind of in there from the beginning, at least from the sort of food, nutrition, and physical activity domain. So people did it because it was required, and there was a lot of interest in the research field to try to look at what kind of policies were getting written. And then in 2010, there was some strengthening to that federal language. So many of the goals, the original goals stayed in there, but they introduced a couple of new things. One is specific guidelines for competitive foods. So back before that, there really wasn't very much federal regulation of sort of vending machines, school stores, the kind of a la carte things that are sold outside the reimbursable school meal. And so that had been, of great concern, particularly with trying to improve the nutrition quality of the food of the school environment. So that got added, that you needed to have specific guidelines. And then also this sort of measuring the implementation of the policy was kind of a vague, mandate. People weren't really doing it. And so they added more specific guidance that it has to be done every 3 years, the triennial assessment. And then there was some language added that you needed to allow families to participate in the process, to really emphasize the importance of that, and letting the community know what was going on, and having a specific person in charge at the school level. So these were sort of all a result of what was learned from watching wellness policies across the country during the first few years that they were required, and this was really designed to make them more effective. So does it matter? The good news is it really does. So there has been quite a lot of research looking at the strength of different policies, and yeah, you can just populate the whole slide. And it really makes a difference. It makes a difference in the quality of the environment when it comes to nutrition and physical activity. It has been shown to have effects on BMI and weight-related outcomes, fruit and vegetable intake. Certainly, having a policy that doesn't allow things like soda and candy has an effect. And we did one study where we looked at the strength of policies across the state of Connecticut that were first introduced, and we had assessed the environment before and after that very first year, 2006, when they came on board, and found that the stronger the policy, the more improvement we saw in the school environment. And it's also been shown to help with physical activity. So the other thing, though, to notice is that I think reflecting who was at the table, and particularly who was held accountable, which typically was the food service director, the elements of the policies were variable in terms of how strong they were and how many components were really written in strong language, which we'll get to in a minute. So the quality varied not only across districts, and over time, you can see they generally got better, but also by domain. So some domains were sort of much better represented. Often the nutrition ones were, whereas some of the other ones weren't getting as much attention. So that brings up the question of how we evaluate these policies. So back when this, WIC Reauthorization Act was first announced, and the requirement was, sort of put out there, and everybody knew this was going to happen, I was really interested in doing research to look at the impact, of course. But if you're going to do that, you need a number. You need some sort of quantitative score to be able to say this is, a strong, comprehensive policy, and then see how it predicts, the other things that you've assessed quantitatively. And so I think if you put so back in 2009, I worked with, I was in Connecticut, and I worked with researchers in Washington State, Pennsylvania, and Minnesota. And we worked together sort of using the policies we collected in our own states to come up with a 96 item measure. Now, this was designed as a research measure, so it was 96 items. It was complicated. We published it, and it turned out to be very popular. In fact, it was so popular that there were people who wanted to use it who were not researchers. And so in 2010, we were funded by the Robert Wood Johnson Foundation to create this online measure. So we had a bunch of stakeholders who worked in school districts and state agencies and things like that to help us pare it down to 50 items and make it much more user-friendly on this online platform. And so that was the introduction of the WellSAT, which you can see here. And then over the years, things kept changing. And so we kept updating it. And as you can see, we didn't do so great at keeping the number down to 50, but we really tried to adjust the questions to reflect the current reality. So for example, once the federal regulations changed in terms of nutrition quality of school meals and, taking out all, sugary drinks in vending machines, we didn't need to assess that at the local level anymore because that was a federal law. So that's an example of sort of things came out and then best practices and new ideas came in. And so we continued to update that through the most recent version, which was in 2018, the WellSAT 3.0. So it assesses sort of these main domains which reflect the original intent of the law, which is nutrition education, nutrition standards, physical activity. And then we really try to ask specific questions to look at how well the law articulates how they're going to implement, ensure compliance, and communicate with all of the stakeholders. And we decided early on that we wanted to assess these policies sort of in two domains that we call strength and comprehensiveness. And strength is really looking at sort of the language, things like must, shall, will, like where if you read it in a policy and it's using that language, it's really supposed to happen. And it's clearly like that's the rule, as opposed to a lot of language we saw early on, in particular, that would say things like, we recommend that teachers don't use food as a reward in the classroom, or, we strive to create this sort of environment. So it was more aspirational or recommended. We wanted to give credit for that. So we sort of scored that using a lower number, and we looked at the overall comprehensiveness. We wanted to take into account how many domains they talked about, but we really did also want a separate number for that strength element for each of the items. So this is still me, right?
Yeah, one more.
Okay. So what we found is that the policies, I think if you keep going, they address the things that were required, but they don't address all of the sort of other elements of student health and school health that are important.
So that's this one.
So the challenge was really thinking, how can we take what was sort of required by the law, was in the wellness policies that were, really first written in 2006 and sort of had been updated over time, and combine it with all of the other parts of the WSC model. And this sort of graphic shows the WellSAT 3.0, and you can see the items there. But we wanted to really develop another tool that addressed the entire WSC model, all of the components. And so that was what we set out to do.
And I think we were very intentional. We have intentional through many, many conversations about how do you go about taking this really rich history and knowledge and use of the WellSAT WSCC, the structures that have been in place, and expand it in a way that can address the other domains. And so that was kind of our challenge when we started and set out to today, where we actually have two options in policy evaluation tools that you can find out. So you have the intact WellSAT 3 if you are interested in going in the direction that has historically been there with regard to those domains of the WSC model. And then we have this WellSAT WSCC, which we're about to introduce you to, which covers all of the things that are in the WellSAT, but expands to other domains should you choose to want to explore them. And so I think that's what we'll talk a little bit. Well, I'll show you in the next slide here. So you can go to our website here, wellsatsuite.chip.uconn.edu, and explore a little bit more about the difference between the two, why you might win and why, or how you might use one tool over the other. And so to just describe a little bit more or dive just a little deeper into the development of the WellSAT WSCC, it's a lot of domains. There are a lot of blue parts, right? And many times we would sit in these our meetings in developing this original matrix of key concepts and say, okay, well, how do we put together the literature and the research in this area and then condense it into a manageable number of items? So Marlene had talked a little bit earlier about how they worked really hard and they continue to work hard to keep the items to a reasonable set. Because if you look at the whole WSCC model, it could be a whole lot of things, right? A lot of things to cover. So we worked to develop this matrix of key concepts and found and dug into finding where the overlap is. Because sometimes, even though they're in the WSCC model as an individual blue box or part circle or whatever you want to call that, that shape, there is overlap across the different domains. So we had to really think about how do we put things into the right bucket for the right space. So we looked at developing that matrix. We consulted national organization guidance, learned a lot about mold, right? We learned a lot about mold at the time, developed the items, went out and asked people, experts in each of the different domains, if we had narrowed the items to a reasonable set within that particular domain, revised domains, went back into schools, sat and asked superintendents and Board of Ed members, how does this look to you? And then developed the guidance and did some pilot testing. I just want to note in that, and I know we'll bring it up again in a little bit later, but in that cognitive pre-testing, we learned a lot about how people look at the WSCC model picture and everybody gets right on board, right? It makes complete sense. But to turn and dive into all of the parts can become overwhelming or complex at times. So it was really a big step for us in the development part. We had gone into this thinking, okay, well, we're going to build something like the WellSAT where it's completely intact. You do everything all at the same time, to get your scores and you're done. What we learned is really that we needed to provide guidance and help people be able to pick and choose areas that may be most relevant to their focus at the time, where they want to go. So you'll learn in a little bit how the WellSAT WSCC is built so that you're going to cover the parts that are in the WSCC, which the WellSAT, I'm sorry, but then you can pick and choose different domains in the blue. Eventually, we think everybody should get around the whole wheel, right? The whole circle, but it may be that you have to take different players at different times to get that done. So we'll dive into that a little bit more. So we ended up, ta-da, with this final measure. Sorry, I didn't end up, that looks very similar. The structure is the same structure or platform that the WellSAT is built on. There are 116 items that go around the wheel. And the point scoring is the same familiarity that you would have with the WellSAT, where you have this 3-point scale and you're scoring for strength and comprehensiveness. Does that make sense? Anything you want to add there, Marlene, before actually I can do this. So we just said that strength and comprehensiveness. 0 meaning it's not mentioned at all in the policy. 1 is that kind of weaker statement, like, yes, we see acknowledgement of that piece, but there's those great words like may, or you could, or you should, or you encourage. So in other words, it would be really difficult to enforce the statement because it's vague, unclear. They're more aspirational. We see a lot of folks that will do aspirational or recommendations or loopholes or kind of future plan to act, but lack of specification. And then there's the two score, which is strong in meeting the expectations. It's clear what's going on here. There's strong language, great words like shall, will, must, have, insist, require, and all of those words. I'm going to turn it back to Marlene and see if there's anything else you want to add on that.
Sure. I mean, one thing I will add in that decision to distinguish between the 1s and 2s, but be sure to include the 1s, isn't so much that we were criticizing these weaker policies, because what we heard was that sometimes that's how you start. right? That it's hard to just go from, not having a policy at all on something that, particularly something that might be very contentious and it might take a while to get everybody bought in. So, the one I mentioned already was, using food as a reward in the classroom. Another one is food celebrations like birthday parties in the classroom. There's some topics, and you all probably know this if you've been paying attention to this issue, that people have very strong feelings about. And so what we saw was districts would sometimes start off by putting in the aspiration, sort of suggesting it, seeing how it goes, getting everybody's buy-in, and then maybe the next time they revise the policy, they actually change it to, a sort of 2-level policy where it's much clearer that this is required and not just a suggestion. So we sort of view that as part of the process of writing and strengthening policies over time. So we're going to code a policy right now just to have a little practice. And the domain we're working on is employee wellness. So one of the items that is in this section of the tool is creating an environment that supports employees' healthy lifestyles. So here's sort of the guidance that we provide to try to illustrate the ones and the twos. So, for example, something that says that they'll create a healthy work environment, but they don't have any examples or anything specific listed, we would consider that a 1, because it's hard to know exactly what that means. And there's an example of from Boston that, and this is a little tricky because it has the word shall, but it's still not very specific. Promote a school environment supportive of healthy behavior. So it's a little, the words don't always tell you the whole story. You have to read the whole sentence. So if you shall do something vague, it still counts as vague. And then I think we have an example of a 2. So this is much clearer. This is actually from a sample policy from the Alliance for Healthier Generation, where they talk specifically about a healthy meeting policy, and that it will be created by the school wellness committee or the district wellness committee to optimize the healthy food options, a variety of choices, and healthy foods that meet a variety of dietary needs. So that's super specific. So if you went to a faculty meeting in that district and all they had were cookies, you could point to that policy and say, actually, this is not consistent with our policy for healthy meetings that we have committed to providing a range of dietary, of options and optimizing the nutrition of those options that are at meetings. Okay, so then another item is looking at methods to communicate information about and encourage participation in available wellness programs. So wellness programs are definitely something that, school districts have gotten very interested in paying attention to. They know, of course, the staff, needs ways to support their own health. So here the coding is same idea, that it might mention it and talk about it being encouraged, but not really explaining what they're doing to help that happen, as opposed to ones that are more specific. And I think we have a couple of examples of each. So sort of saying we should develop and promote this plan would be sort of a recommendation. And then if you put up the other example, this one is much more clear. It says each school and site shall designate one staff member to serve as a wellness champion. So you've got a person who's really tasked with this, and they're responsible for communicating the information. This is from Baltimore, to the staff at their school or their site. So that's sort of specific guidance, and, making it clear that someone will be responsible for making sure this happens. We really, their thinking is that's more likely to happen in Baltimore than in a district that has a policy like the other one we saw, where it was just sort of a recommendation, but you really didn't know who was going to be in charge of making sure it happened. So there is a couple of just caveats to this. this is certainly designed to be a tool to help districts evaluate their policies. Getting reliability, we've been doing research with this. So when you are doing research, you need inter-rater reliability. We need to make sure that, doesn't matter who's using the tool, that they're going to get the right answer. So we worked pretty hard to try to have specific examples, specific guidance and examples so that people could determine particularly differences between a 1 and a 2. But we also want to acknowledge that there is variation in scores. And in the terms of the practical use of this tool, when you're not trying to do a research study, it's less important that you worry about the exact right score and get hung up on that. And instead, really just, it's almost more important that you sort of figure out where you are now and where you want to go. And the degree to which the tool can sort of help you do that, we would consider that a success in terms of its use in the field. So this is just a little caveat because, it's sort of that transition of what was originally developed very much as a research tool to really being a practical tool that can be used in school districts. So I'm just going to show you a little bit more about sort of what the system looks like when you log on to complete a WellSAT WSCC assessment. So as Sandy showed you, you can kind of log on to our site where it shows you the different options. So WellSAT 3.0 is the kind of original nutrition physical activity tool. And then WellSAT WSCC, and we're actually up to 2.0 because we did have an original version, we published it, and then we did some work with it and we updated it some. So that's the version that's on there right now. And so you would select that.
And I'll just note here too, so Marlene's going to walk us through the online platform because again, you'll see very, very much parallels between the systems because we built them at the same time. You also have the opportunity to download this and do it in paper and pencil if you prefer. So, but we'll share that a little bit later as well. But here we go.
So, so this is the website. So it's wsc.wellsat.org. You do need to create an account, and that really does help identify the school, like you'll be able to identify your district. What's helpful about that, and we've actually seen this quite a lot as schools, as districts have been required to assess their policies, their sort of traditional wellness policies, is a lot of times you'll have changes in staff and somebody comes in and they know that the policy got scored, but they don't really know where it is and how to find it. Because there's an account and we can identify what district goes with which set of scores, this really helps us be able to help people find their scores and access their scores later. So anyway, you go in and it's, a typical signing up, creating an account and registering. It does work right away once you do it. And then here again, you determine whether you're going to use the sort of 3.0, just nutrition, physical activity questions, or you want to add some of the WSCC domains. And then here, you put in the name of the assessment. So you would put in something like your, let's just say, I'll use my school district, Guilford Public Schools, September 2022. So something kind of specific so that you know which policy you're assessing. And then there's some drop-down menus that we actually took data from the NCES database. And so if you drop down and select your state, it then gives you a list of districts and then or of counties actually, and then districts. So you'll be able to kind of use sequentially 3 different drop-down menus to get your exact school district. And then you'll have that NCES number. If you know the number already, you can just enter that. There is an option that if you just want to practice and you don't want this to be used in any, for any other reason, or someone 2 years from now going back and thinking it was a real assessment, you can click practice mode and that'll show up in the data. And then you put in the month of year of the policy. So we do track the month and year of when the assessment was done. So we know that, but more importantly, if you're, these policies are meant to be updated over time. And so you want to put in the month of the year of the policy that you're actually assessing. And then you click the complete a new wellness policy assessment. Then this is really what I think is pretty cool. And sort of going back to what Sandy said, that It's really kind of unrealistic to expect anyone to sit down and code because the number of policies, I mean, you guys probably know the number of different policies that get addressed by all of the components of the WSC model is huge. So what we think was a more realistic way to go about it is to list all of the components here and then have districts decide where to start. So this person has clicked social and emotional climate. And so it'll really start with that subscale and asking questions about that. And this way people can, make progress over time and ultimately, hopefully look at all of their policies, but we wanted to really make it clear that that's not an expectation from the beginning.
You could click them all if you really wanted to, right?
You
But the
can.
other thing I would draw attention to, again, in the resources that we have available is, as we were creating these items and piloting, we tried to create lists of where you might be most likely to find content related to this particular domain. So if you look on the right, you see the definition of the domain, but then suggested like starting points for policy documents to look for, to kind of help guide you to where to start.
Yeah. So then you sort of are put right into the tool, and the way it works is each item has sort of a number, which is the sort of initials of the subscale, plus they're just numbered sequentially starting with 1 for each subscale. It has a general definition of the subject, and then I'm not sure if the slide does this, but if you click on the little question mark, it then pulls up the guidance for that item. So it'll have the sort of 0, 1, and 2. Yeah, I don't know if it was, I can't remember
this
if
is
we had
static. This is static.
Okay. So, but that's where you would click. You would click on the little question mark, and that would give you the coding guidance. And people, there are people who've gotten a lot of experience coding policies. And, sometimes they can just zip on through and they don't need to check the guidance every time, but we wanted it to be right there for people who are working on it and are less familiar with the guidance. Then we put in an NA option because some of these items are specific, for example, to a grade level. So we have sort of recess in elementary schools. Well, there might be districts, and this happens in Connecticut, that don't have every school level in that district. And so we wanted to give people the option of just saying not applicable, and it's not going to affect your score. It's like that item sort of just disappears altogether. And then you click either the 0, 1, or 2. And then there's on the right, you can also look up your saved policies. You don't have to do the whole thing at once. You can sign out and return later. You sort of log back in, and on that first screen, you can look below and see the policies you've started and just jump right back in and keep working on them.
And I think that's a really maybe key point to emphasize before we jump into other resources too, because I'm watching the chat, by the way, and Caitlin did put the link directly in the chat. So if you'd like to link and take a look at it, is there. But we didn't really cover, or we sort of danced around the idea of who should be doing this measure, right? So Marlene in the very beginning was talking about how oftentimes it's fallen to food services directors to do the school wellness policy. Well, now we've opened the whole world, right? The whole WSC world of all of the different buckets. And it wouldn't make sense to, if we go back in the slide, hang on, to necessarily have all the same players at all the same time, right? So it's to think about who is the person that's best able to work in this area, who's able to supervise kind of the overall work, right? Who's best at doing that, and then bring in the expertise as you need it to help with the completion. I think that's the key piece.
Exactly. And, I think in a perfect world, it would be amazing to have a group of people around the table, the entire wellness committee that really included all of the people who would be able to answer these questions and do it together. Another option would be to use the hard copies and maybe break into groups and have people put it down on the hard copy, and then one person goes and enters it onto the website. There are sort of different options, but if you do create an account and it's designed to be like your school district's account, then you can also have multiple people log in using that account and update the same, sort of like a Google Doc, sort of update the same coding sort of record. But I think that what I would love to see would be people really sitting down together at a table and talking about it. Because to Sandy's point at the very beginning, you want to really facilitate that coordination and that awareness of how there's connections across all of these different aspects of school health.
Particularly when we start to see things that cross across different of the blue parts. So I remember when we were first developing a bunch of this, we would find in some policy, some district examples, wellness related information not in their school wellness policy. And Marlene would explain, why is that? Why is that? Why is that? Well, there are things that are interconnected and kind of historical things that happen in districts. So, the more players you can get at the table at key times, the better off. But you do need to have some coordination center, and then maybe you can ebb and flow or have an activity.
Yeah, no, it makes it harder when things are in different places, but at the same time, it really sort of highlights how you need everyone on board. So like, for example, one of the items, there's been a lot of work on farm to school and trying to really use local producers of fruits and vegetables and other food products in school districts. And we think of that as a school wellness policy issue. Well, a lot of times it's a procurement issue. And so it's in the procurement policy. So that's just one example of where, these, in some ways, these things are pulled apart very artificially. And so that's, again, why you really need great communication among your different stakeholders.
Why we need the white matter, basically, right?
Right.
There we go. Okay, so I don't see any questions in the chat about the actual tool. So we're going to switch now to resources that can support your use of the WellSAT WSCC tool, and then also some new things that we have coming out that should help. We're hoping to facilitate your work around WellSAT WSCC policy overall, whether or not you're using specifically WellSAT WSCC or not. So on our website, again, when you go to the other website or our CSCH website, you can go to the section that says in linking in policy, and we do have an instructional video. We have a podcast up that you could listen to, a brief, a user manual, coding guide, score sheet, again, that you can download in paper and pencil if you want, or I'm kind of still a paper person. I guess I'm old fashioned. I like to have it sitting next to me while I'm going through something. So these are all of the materials that should hopefully support your use of using the actual WellSAT WSCC. Some of the newer tools that Marlene and I are about to release, so they're not publicly up yet, but they are going to be within the next week, is this idea of WSCC blueprinting. So I think, I'm completely sold on the what and why the WSCC model is so important. For me, even as a school psychologist doing my work in my little world, I'm completely sold that the model, the what is so critically important. What I think we need to do is have more resources and facilitation and opportunities to build these times for team tabling on the how. What do we do in the how? So we've been working really over, I think, the past couple of years to build these blueprints. So we have a WSCC policy blueprint and we have a WSCC practice blueprint. And again, both of them have been piloted and are about to be released in the next week or so. They're intended for kind of the leadership teams, whoever is involved in the district, or at least not for so I'm going to talk specifically about the policy blueprint. So the policy blueprint is intended for school and district administrators, leadership teams. Again, you can work through this policy blueprinting activities individually or as a team. We've broken it into 10 sessions. You can kind of look through and see which ones you need to work on, or if you need to go from start to finish, of activities that would be about 30 to 45 minutes each, so that you will end up at the end of the policy blueprint with action plans for policy changes that could help to strengthen equity and whole child development in your setting. As you might guess, within our policy blueprint, there are multiple opportunities to use the WellSAT WSCC to help in the coding of the policies that you have. But what you'll do is you'll take the results from that WellSAT WSCC work and really work through these other activities to think about where we need to make those changes. We embedded within the entire policy blueprint is implementation science and implementation framework throughout all of the activities. And we summarize them as the 3 E's of blueprinting. which is about exploring, evaluating, and establishing. So as might be expected in an exploring context situation, what you're doing is really taking that 10,000-foot view and to identify strengths and needs in whole child development and the work that you're doing in the policy space. In evaluating directions, you're examining opportunities for strengthening different initiatives. And we have a lot of emphasis in this section about really thinking about what it is that you're doing. Do you really need to add something else? Or is it a process of refining, or even more importantly, de-implementation? So we have a whole section in there about we need to get rid of things just as much as we do need to add things in. And so there's whole sections on that. And then finally, we're establishing actions. We're almost ready for the go button, right? To planning for success. So we're going to identify action plans, and equally important, we're going to identify anticipated barriers and plan ahead for success for those. So the last couple of slides we have here are just a couple of like little snip pictures from the different activities that we have from sample blueprinting activities. I think I picked one from each. So in an exploring context activity, might be identifying your existing policies and resources. As silly as it seems, or as simple as it might seem, again, when we got into the process of doing the pilot work with the WellSAT WSCC, it took us a while to figure out which policies go where and how they should be mapped into the different domains. So this is your opportunity to start to look at what are the policies that you might want to emphasize or look at in these particular domains, and who would be at that table, right? Who has the expertise related to that policy? And then what other resources might I have access to that would connect to that policy? So it's kind of like a map, the big overall map of exploring what you've got in these particular areas. When we get to evaluating directions, this is where we're going to zoom in to the specific policy. So we might have the policy listed here, and then we're going to start generating ideas about either updates, things we need to get rid of, or things that we need to add. And so we have a series of questions where you're jotting notes around each of these areas. I have a quick example here. Again, it's a little bit wonky in terms of fitting it into a PowerPoint slide, but let's say that we have a district that wanted to work on their social emotional climate. And so they pick the 3 policies and they review them in discipline, school climate, and bully prevention. And they start making notes about things that they could change or add or subtract in those areas. So discipline policy, let's see, we have here, update to remove zero tolerance language, update to reflect the things that we're doing to minimize exclusionary discipline and assess for disproportionality. Maybe we want to think about adding restorative practices, which of course would require implementation of those practices. So right now we're brainstorming, we're generating potential ideas of what we think maybe we could do. Then in that next activity, we're going to establish actions. We actually need to figure out if we should do those things, right? Because it's really easy for all of us to sit around the table and come up with lots of ideas. But then we have to step back and say, what are the things that we can do? And so we have this next activity that would be looking at readiness and urgency, kind of this matrix of thinking about, we need to do this right now and we are ready to do this, versus, well, it'd be nice, but it's not urgent. So if we're going to prioritize the things that we can do, what do we what would be our list in order? So if it's high urgency, high readiness, we want to pursue it. If it's low readiness, high urgency, maybe we wait. If it's low and low. And maybe if we're really ready and low urgency, maybe we potentially wait. Again, not super clear, except to say that it's the process, again, of setting up for success, which requires some really careful thought. So in this example, I brought back to this example of the possible recommendations in social emotional climate for this district. The district went and put their things into boxes. And so we have no boxes in high urgency, high readiness, but we've got things that we can be working on. So maybe in my district, I want to work on this box here with low urgency, high readiness, because these are things that I'm closer to being ready to do. And then also maybe replacing this annual anti-bullying assembly with a more evidence-based strategy for bully prevention. The restorative practices may be my least priority when I come out into action planning, because that's going to take more resources and work to be able to implement. Again, all different kinds of examples throughout the whole policy blueprint, really focused on taking the what, so that model, and bringing that white matter to life. So the coordination of policy, process, and practice to really get into the how do we blueprint for success in both our policy work and our practice work. I think that is the end, and we can open to questions, and we're right on time with 10 minutes left. And
I just want to make one quick comment just on that relationship between the policy and the practice, which we've looked at a lot with like specific school districts. Everyone's always scared that this exercise is going to show that they're not following their policies and that they're going to get in trouble. And having done this type of assessment in dozens and dozens of districts, I can tell you that's often not the problem. The problem is usually that there's lots of stuff going on. There's lots of practices that are being implemented, but nowhere are they written down in a policy. And one of the reasons to really try to remedy that is to really incorporate it into the district's. If you incorporate it into the district's policy, you're number one, really highlighting what you're doing, but for anybody, who's looking, but you're also really helping make sure that it continues. Because sometimes what happens is you have a super passionate school nurse or a super passionate, health education teacher who might be doing above and beyond, and those practices are in place and they're not in the policy, but if they get into the policy, then hopefully that will continue into the future.
Perfectly said, right? And again, even though in the blueprinting activities, we split them into policy and practice, that's just because oftentimes those players are different, but but within each of those blueprints, they're referencing each other, if that makes sense. I think as Marlene used to say, you want to make sure that it's that it continues well after you're gone, right? So yeah. Part of an implementation science, again, is getting to the step of sustainability, and we can do that through some policy pieces. No questions, just a comment. Thank you, Lynn, about the tool and the resources. And we have
and I'll add, if anyone wants to ask their question via their microphone, feel free to raise your hand and we can grant you access to unmute yourself. Because I know sometimes the questions, if you try to type them out, they get real long and seem to take forever to type out. So feel free to raise your hand and then you can ask your question via microphone.
Or in my case, I'm sometimes not sure what I'm trying to ask until I start talking, right? Let's see. So Jenna has asked, will the policy blueprint document include model policy language for all of these other WSC related policies beyond the school wellness policy? The policy blueprinting document doesn't have model policy because it really is focused on activities to help you work through your policy. It is something that we've been working on, Marlene, right? In terms of.
Yeah, and the guidance document for coding has examples in it. So if you are looking, it's not sort of all put together in like one model policy. That's actually a great idea. But if you're sort of going through, there will be examples that we've pulled from policies to illustrate what we see as being a strong policy.
Right. So as we were doing the development and went out to look for examples, or when we were doing coding and found really good examples, we would put them in, but they're more at the kind of within the domain item level than, as Marlene had said, like complete model policies. That's the next step, maybe. Any other, oops, yeah. I guess I could stop the share too. Okay, and so Anna has said, thank you for all this. Any suggestions on how to use the tools in a very large school district? Really great policies, but struggle with implementation at the 600+ schools. You want to take that, Marlene, or you want me to take it?
I mean, I hear you. that is a huge challenge and definitely harder. I don't know if you want to unmute, but I'm just curious. So does Chicago have its own sort of district level committee? Are there school level committees as well in Chicago?
Yes, so there is a WISC committee at the district level that is working on this work. And then at the school level, there is supposed to be a wellness committee at every school. Again, right, that's in the policy. There is supposed to be.
Right.
Some schools do that really, really well. Some schools don't have it at all. And then there's a bunch in between.
Yeah.
So to
So-
me, sorry,
Go ahead.
Oh, I was going to say, to me, that school level wellness committee is where we might want to see some of the practice blueprinting happening, because at the school level, you're not going to necessarily, there are pieces in our blueprint about advising or being an advocate around policy change, but really at the school level, you're working on making sure things are in practice that are aligned with the district level policies. Is that what I'm trying to say? Marlene's looking at me like,
Yeah,
okay,
no,
I
I think that's right. I was just gonna mention, there was a project, it wasn't 600 schools, it was maybe like 37 or something, but there was a project that I did in a district where they had each school sort of fill out a questionnaire looking at their practices. And then we looked at the district policy, and then we kind of mapped, and we were able to see, but this was with just WellSat 3.0, so it wasn't as many items, but you could pick a domain that you want to do this, and you can't do it in everything. And then we could see like this policy is being implemented in 70% of the schools. This one is only being implemented in 20% of the schools. So I would just use a divide and conquer strategy. Maybe start with your elementary schools, or maybe start with your high schools, or maybe pick a section of the district, or even maybe start with the ones that want to do this. So you kind of, are engaging the people who are really interested first. That won't be all 600, and kind of start really building that model of showing how it can be done in Chicago. And then sometimes I feel like another great way of sort of getting people excited about it is for, principals to hear from other principals, as opposed to someone at the district level, to really kind of do that peer-to-peer sharing. I was gonna answer, but it looks like you found the answer.
And I just wrote in the answer too on
Yeah, so WellSat 3.0 is inside of WellSat WSC. So WellSat WSC is like an expansion of 3.0. So if you've already done, in fact, if you've already done a 3.0, which it's possible a lot of districts used it for the triennial assessment that has been kind of due it was supposed to be due in 2020, and it keeps getting pushed out. But a lot of districts have done their triennial assessment and have used 3.0. You can go ahead and just like copy those answers into your WellSat WSC. So that part's done. And then you just go on and do the additional domains.
So I think I'm sharing that picture now that just shows kind of that overlap and differences across between the two, just to help clarify. Sorry for the dizzying backwards scrolling, but
yeah, I mean, we felt like 3.0, I mean, 3.0 has been used by thousands of people around the country, and we just felt like we didn't want to confuse things by not having them completely like sync up with each other. So even though it makes the number of items higher than maybe it would have been if we had just focused on, the WSC model by itself, we kind of, the horse had left the barn. Like already people had been using this tool, they were used to it, they had scores. So we felt like this was probably a better way to conceptualize it, that this is an expansion.
Okay, I think we have like maybe one more question or so. Yes, so Ellen, it was just reminding us that if you've already completed the WellSat 3.0, you have the option to import your scores. So not a do-over, but an add-on. Let's say you wanted to go and add social emotional climate, for example. So you can bring over your WellSat scores and then go and add the domain of social emotional climate.
So I'm going to go ahead and jump in real quick. If people are still or typing questions, feel free to do so. But I just want to say that, well, first off, thank you all for joining us today. And thank you, Sandy and Marlene, for, presenting this. I'm going to throw in the chat box a link to the evaluation for today's webinar. If you want to receive CEs for the webinar today, you will need to fill out that evaluation. Also, within the next day, I will be sending out an email that will include the recording to today's webinar, presentation slides, as well as any other resources that Sandy and Marlene have to offer, which they have so many great resources. So we'll be sure to get those out to you all within the next day. That's it for me, though. But if anyone has any questions, you can feel free to reach out to us at ASHA by emailing us at info@ashaweb.org. Other than that, I hope you all have a great rest of your day and great rest of the week.
Thank you.
Thanks, everyone.
Thank you all.